Hello, I'm Tamia Crandall, and today I will be doing an interview with Hannah Kerr, the orthopedic surgeon. And let's get right onto the questions. So, Hannah, since most of our viewers probably don't know what an orthopedic surgeon is, can you please explain to our audience members and viewers at home what orthopedic surgery is?
Hi, I'm Dr. Page and I'm an orthopedic surgeon. My job allows me to work with the musculoskeletal system, which essentially is the system that provides form, support, stability, and movement throughout your entire body. It is the system that is made up of bones from the skeletal system, along with muscles, cartilage, tendons, ligaments, joints, and other connective tissues that support and bind tissues and organs together. My job is I get to address situations that involve trauma, tumors, injuries, infections, and other conditions that could require surgical intervention. Yet, I could also use different forms of treatment when necessary.
What are some causes that would cause patients to need orthopedic surgery?
What brings patients into my office is individuals who are experiencing long-term tendon, muscle, or joint pain. This can include anywhere between knee problem, shoulder problem, chronic back pains, sprains, strains, and just general overuse injuries. Right now, there's more than 28 million Americans who develop some type of musculoskeletal problem every single year.
What treatments do you provide for your patients when needing orthopedic surgery? And if they don't need orthopedic surgery, do you have any other treatments that you would provide to them?
As I mentioned earlier, we do not recommend surgery to all of our patients. We may also recommend self-care, which would include physical exercise and a heating pad. We may also recommend therapies, which would include chiropractic treatment techniques and physical therapy. We may also recommend just straight medications, which would include non-steroidal anti-inflammatory drugs, which would increase the comfort level of our patient and decrease the discomfort caused by inflammation of the injury that our patient is experiencing. We may also offer steroid injections, which is our medical procedure route, and then, of course, there's always surgery that we may recommend.
What are some of the surgeries that you perform on your patients when they need it?
So, since surgery is definitely our specialty, we do have a variety of surgical options. Surgeries that I perform include dissectomies, laminectomy, laminotomy, intervertebral disc annuloplasty, intervertebral disc arthroplasty, laminoplasty, vasectomy, annuloplasty, foraminotomy, spinal surgery, and spinal fusion. The first option that we have is a dissectomy, the surgical removal of a bulging or herniated disc that presses on a nerve or the spinal cord. The next option that we offer for surgery is a laminectomy, which is the surgical removal of the back part of the vertebrae to relieve pressure on the spine or the nerve. The next surgery that we perform is a laminotomy, which is the surgical removal of the bony arch of a vertebrae to relieve pressure on the spine or nerve. A lot of these procedures can be used on different bones of the body. For instance, fusion may be used in your arm if you break it.
Can you name and explain some of the utensils that you use during your procedures?
So, as any other surgeon can tell you, we do use a lot of tools during surgery. When doing surgery, I use a series of mallets, pins, wires, ostium, rongeurs, clamps, retractors, elevators, cutters, and forceps, including but not limited to. One of the more popular elevators that any orthopedic surgeon will use is the key elevator, which is used for cutting and dissecting. This is used to elevate the periosteum from bone. The Volkmann rake retractor is used for retracting and exposing. This sharp four-prong rake for retracting tissue is extremely helpful in my surgeries. Like many of these tools are very dependent on the surgery that is being performed. I would like to thank you for having me on your show today, and I would like to thank all the viewers for taking time to really learn about my profession.
And that was my interview with Dr. Kerr.